So what is upper cervical chiropractic and how is it different than regular chiropractic? Well, as the name implies, upper cervical, cervical meaning neck, means we focus on the upper neck. But don't let that fool you. It doesn't mean that every patient we see only has upper neck pain. The upper neck is related to the entire body, both structurally and neurologically, which is why we focus there. If you're only going to make one adjustment and have a massive effect all over the place, it would have to be the upper neck. Now, there are some key differences between regular chiropractic care, or what we call sometimes general chiropractic care, and upper cervical. Most notably, where we adjust. General chiropractic care will often adjust all over the spine, the neck, the mid-back, the low back, the hips, sometimes even extremities, and often multiple places on every visit. Whereas upper cervical chiropractic care, obviously we only focus in the upper neck, but one of the key distinctions is that we don't even adjust every time that we see the patient, which may be a bit unusual, especially if you had experience with regular chiropractic care where you pretty much get an adjustment or multiple adjustments on every visit. Now, why would we not adjust a patient on every visit? Well, it's similar to like a mechanic who isn't going to work on a car that isn't broken, or a surgeon who's not going to do surgery on a patient that doesn't need it. Making an adjustment is something that should be based upon data and objective testing to make sure the patient actually needs it. Now, what the patient wants out of the experience is to feel better, to have whatever symptom or symptoms that brought them into the office to go away and stay away. And what the upper cervical chiropractor needs to know how to do is know when to adjust the patient, where to adjust the patient, because even in the upper neck, there's still multiple ways that you might need to adjust it. And then most importantly, when to stop adjusting and let the patient heal. Getting somebody well isn't tied to adjusting them often or aggressively or multiple times in the same visit, thinking that you're going to get there faster. Adjusting a patient in the upper cervical spine requires good timing and a delicate touch. It's kind of like growing a garden. Water is necessary and good soil is necessary and sunlight is necessary for those plants to grow. But too much of any of those and you're going to ruin it. And the same is true with chiropractic care. So that's why we don't adjust a patient on every visit, because honestly, a patient doesn't need an adjustment on every visit. And how do we know when to make those adjustments? Well, we do objective testing on every visit. In our office here in Chico, we use infrared thermography. Thermography is probably the most objective, safest, and easiest test to do to look at the function of the nervous system on every visit. And it's a real-time test. It doesn't require taking a monitor home or something. You can do the test real time in the office. There's a bit of an acclimation period because the test is temperature sensitive, but we'll get real-time data on every visit on how that patient's nervous system is performing. If we find there to be a problem, or what we call a thermographic pattern, that's when we know to make the adjustment. And sometimes our timing of the adjustment doesn't always make sense to the patient because on that particular visit or that particular day they feel pretty good and we decide to make an adjustment. And there may be times when they come in and they don't feel all that well and we decide to leave them alone. And the patient's used to having stuff done to them when their symptoms are flared up and left alone when the symptoms are okay. But in that context, you're just chasing symptoms. You're not actually getting to the heart of the matter because you can't always feel when there's a problem in the body. So with objective testing, we know when to make the adjustment and when to leave the person alone because their body is already healing just fine by itself. Now, as far as adjusting the upper neck, there's a few key tests we have to do in the beginning to make sure that A, somebody's problem is actually related to the upper neck, and B, we know exactly how to adjust the upper neck. Another big difference between general chiropractic care and upper cervical chiropractic care is that upper cervical chiropractic care often requires x-rays to know exactly how to adjust the fixated joints in the upper neck. The bones of the upper neck are pretty small and pretty deep under the tissue. So you can feel them, yes, if you have a pretty sensitive touch and you can palpate them, but you can't palpate them or feel them with enough accuracy to know exactly how to make the adjustment, which is a big difference from general chiropractic care. In most offices, general chiropractors don't even use x-rays anymore. They just feel things or ask you where you hurt, and they start popping and cracking and getting things moving. And that can feel better, and sometimes it even lasts for a long time. But in some cases, it doesn't really help at all, or it can make things worse. And patients notice the symptoms keep coming back over and over again. So to get a lasting change with how the body functions, we have to get to the root of the problem. And sometimes that's going to be in the upper neck. So when you're a new patient of an upper cervical chiropractor, like in our office, you don't come in for the first day, lay on the table and start getting adjusted. There's some pretty detailed testing that's required. We do digital x-rays, we do those thermography tests, we do a handful of orthopedic and neurological tests also, those that are appropriate for the symptoms. And we try to get a full clinical picture of exactly what's wrong, where it's coming from, and decide if it makes sense to make a few careful adjustments to the upper neck, or perhaps this person's symptoms are coming from some other part of the body, or some other situation is happening where we need to refer them out. Not every case that comes to see us, not every symptom that we've helped before is an automatic surefire new patient and lead to an adjustment. There's other things that could cause headaches or migraines or jaw pain or dizziness, and we need to make sure in the initial testing process that we screen for those things and do our due diligence as doctors and make sure that we don't make any assumptions that are unhelpful or sometimes even unsafe because we're adjusting a patient that doesn't really need an adjustment because their symptoms are coming from somewhere else. Now, when it comes to safety of the adjustment, there are some patients who are pretty nervous about getting their neck adjusted. And most of the time, those patients are fearful of some rapid twisting of the neck because they've seen similar videos on YouTube or Instagram or something. Well, rest assured, upper cervical chiropractic doesn't need to make any rapid, aggressive twisting of the neck to make the adjustment. In most cases, the adjustments are quite gentle, they're very fast, and there's no twisting of the neck involved. In fact, we only have to adjust one side, whereas if you ask patients of general chiropractors, most of the time when you ask them, well, how did you get adjusted? And what did that feel like? What did the doctor do? And they're going to tell you, oh, well, they twisted my neck one way, and then they twisted it back the other way, and then they laid me on their side and twisted me one way and jumped on my lower back and adjusted that and flipped me over. And it's just kind of this mechanical, wrenching and twisting of the spine, trying to make things pop and crack, which can feel good and is usually pretty safe, but is it going to be long lasting? Was it actually necessary? Is it addressing the root cause of the problem? I guess that's up to question. So upper cervical chiropractic care is still chiropractic care, but it's quite different than general chiropractic care. There's much more advanced testing. There's much more objective testing along the entire course of care, and the adjustments are only given when necessary based on testing, not just because the patient's in the office or not just because they have a symptom that day. And thankfully, most chiropractic cases with upper cervical care as the technique, they do have a great track record of success with long-lasting results, especially with conditions like headaches, migraines, dizziness, jaw tension or jaw pain, sometimes even anxiety, sometimes even digestive issues, neck pain, back pain. Believe it or not, a lot of upper cervical chiropractic patients have chronic low back pain that didn't respond very well to general chiropractic care or to other modalities, massage therapy, physical therapy. Not to say those modalities aren't effective, but in some cases, they just miss the root cause of the problem. And the reason for that is that the upper cervical spine and the levelness of how your head sets on your neck determines how the rest of the body lines itself up. So if there's a kink or a problem in the upper neck structurally, sometimes your body's going to compensate for that with mid-back and low back curvature changes, which of course, if left alone for long enough, will begin to ache and hurt. And if you're just chasing symptoms, you may be led to believe that, oh man, I have a mid-back problem that just doesn't seem to go away, or a low back problem that doesn't want to go away. And you do things at those areas and rest assured the problem comes right back or never even went away in the first place. And not until you find the root cause of the problem in the upper neck do you get the lasting changes you're looking for. So again, upper cervical chiropractic, yes, we focus on just the upper neck, but don't let that fool you in thinking it's just for upper neck problems. It's a whole body solution sometimes, and not just structurally, not just with your muscles and your joints and your bones, but also functionally. All the organs and glands and tissues and subsystems of the body take direction from the brainstem and the upper neck. There's a very unique and very powerful relationship between the upper neck and the brainstem. So when you adjust the upper neck properly and when necessary, you also free up the nervous system to function more normally more of the time. And the whole body responds super well for that. So hopefully that answered your question about what upper cervical chiropractic is, how it's different, the fact that it's very safe, it's based on objective testing. If you have any questions, you're always welcome to reach out to me below. My contact info is in the video, or you can look up my office on the website here in Chico. Thanks for watching. Source Point Care Chiropractic. Take care.